Hi, this is Billy Tarasio with the Modern Divorce Podcast, joined here today by Dr. No, not doctor. What's the
No.
title? Counselor?
Yeah, just a licensed professional counselor.
Licensed professional counselor Myra Hurtado. I have known Myra for a few years, and I guess I wanted to call her doctor because she's pretty darn fabulous. And today we're going to be talking about the mind-body connection, the trauma that comes with divorce, and healing your family from that, and whatever else happens to come up. So, Myra, welcome to the show.
Thank you. Thank you for having me.
Yeah. So, Myra, tell me a little bit about what you do in the center that you're at.
So actually, we're coming up on 1 year. It's kind of crazy. It's gone really, really fast. Last October, my sister and I opened up the Integrative Healing Center of Arizona in Gilbert. And the reason we both just had a passion for care to help people. Obviously, as you said, I'm a counselor, and my specialty is trauma and working with the mental health side of things. And my sister is a family nurse practitioner,
Mm.
and she specializes in internal balance and wellness. So we're talking about thyroid, adrenal, hormone balance, and even gut health. And so what we found was just the gaps for both of us, right? So from a medical model, she was having patients come in with high anxiety, having trouble sleeping, and really just struggling on a lot of different levels. And she would she would do their blood work and look at their
Mhm.
levels and say, wow, like you're off in all these different ways. There's a lot that we can do to support your body.
Mhm.
And there's a lot of reasons, there's a lot of physiological reasons that you're having some of these, um, these symptoms. And
Mhm.
then she would say, however, the body became so imbalanced largely due to unmanaged stress and trauma, unprocessed trauma. And so she would say, let's get you balanced, but truly, we also need to work on this other part of it in order for you to be able to land in that space where you can process what's happened,
Mhm.
right, and feel like you can move forward in a healthy way. And so she was constantly referring to me. And then I'm working with trauma, with patients or clients, with all kinds of things going on in their lives. There could be abuse or neglect or conflict in relationships, things that have happened that are out of our control, just overwhelming. Right now in our world, I feel like everybody's brain's on fire, right?
Mhm.
You
Right.
can't, yeah, you can't turn and look and see and hear anything without feeling distressed.
Mhm.
Well, that takes a toll on our bodies.
Mhm.
So as I'm processing with people and really helping people to kind of really understand and figure out what's going on for them, and to really process through some of these overwhelming stressors, I'm also saying, okay, what's going on for you physically?
Mhm.
Because we can do all of this work. And if you don't have the internal resources you need, we're not going to get the traction that we really need. Right. And so I'd say, let's go get your blood work done. Let's
Mhm.
look at these levels,
Yeah.
go see somebody. So this is the heart, right? So what we did was we said, let's find a place where we can do collaborative care, where people can, sign a release of information and say, hey, I would love it if you could talk about what's going on for me. And then we get to work in this holistic way to really help people. So in our center, we have Cheryl, which is naturally balanced. And like I said, she is a family nurse practitioner. We have a nutritionist, Stephanie Kroon, and she's amazing. She really works on the microbiome of the gut, which is our
Mhm.
second brain. And she specializes in ADHD, and she does allergy testing and food sensitivity. And she helps people with high blood. It's everything. It's beautiful. She does amazing work. We have a massage therapist.
Mhm.
We have an esthetician. We
Mhm.
had a yoga therapist, and we partner with a psych nurse practitioner. She's not in our center, but we partner with her as well. Just so
Wow.
that, yeah, so we can just offer, if people choose, right? Because everybody's an independent clinician. So
Yeah.
if I, yeah, so we're all independent in the same space. So some people just come and they just want to work on this, and that's fine. But if we can offer that as a resource, it's really, really amazing.
That's pretty fantastic. So I love that you all are collaborating. When I first learned about you, you were recommended in the collaborative law group as a co-parenting counselor. Now, a ton of my clients are interested in co-parenting counseling.
Mhm.
What is that specifically?
So, you know, let's just say divorce is a trauma,
Mm,
all by itself. Now, what has led to a divorce is often traumatic also.
absolutely. Yeah.
Yeah. Yeah.
Marriages don't break up because they're peaceful and happy.
Right. Right. So we've got a lot of factors at play here. We have patterns in relationships. We've got hurt. There's been wounding, obviously, in some kind, betrayal. There's maybe a lack of trust. I mean, very seldom are you going to see a divorce where people are like, we've just grown apart. We're best friends, and
Mhm.
we're going to just co-parent and living
Yeah.
separately.
They
That
don't need co-parenting counseling.
Yeah, right. Right. So because we're talking about people who've experienced something traumatic, a betrayal of some kind, this person that was once felt safe is no longer feels safe. They don't have my best interest in mind. Maybe I believe they don't have my kids' best interest in mind,
Mhm.
right? So we're talking the most vulnerable and raw that you can be. It's
Mhm.
painful,
Mhm.
and it's an abrupt change in life, right? For you, for your children. So co-parenting becomes really difficult.
Mhm.
And I remember I heard somebody once say that we really have to be able to shift from a personal relationship to a business relationship.
Mhm.
That's pretty hard to do because
Yeah.
there's a lot of feelings. It feels pretty personal, right?
Right.
So when we're talking about co-parenting counseling, what we're talking about is having a third person, which allows for accountability,
Yeah.
right? To be able to walk with both parents, and really at the heart of that is, how do we do what's best for my child?
Mhm.
How do we do what's best for my child? So this isn't about me getting my needs met.
Mhm.
This isn't about me getting back at my ex. This isn't about me. This is now about my child.
So you're not helping people or couples process what happened to them individually or even the death of their own relationship.
Oh no, that for sure is needed. You
Oh.
when you asked about what co-parenting counseling looks like, the truth is that we're talking about the new space between mom and dad, and how do we effectively co-parent. I absolutely recommend individual work
Mhm.
for both parents, or for maybe one of the parents that's really stuck,
Mhm.
right? Because
Mhm.
what happens is if a parent is stuck in their pain and
Mhm.
they're stuck in their trauma, then their behavior is really not about their children.
Mhm.
It's about them either defending, right, in some kind of a way, or weaponizing,
Mhm.
right? And so we're not our best selves. We're not our best selves because we're so hurt that we're so busy defending
Mhm.
or trying to attack,
Mhm.
right? That the focus can't be on the child. So I absolutely recommend individual work around the trauma part was because it is a death. You're right. It's a massive death
Mhm.
of a marriage and of a
Mhm.
family unit. So yes. But once we're doing those pieces individually, then working on the co-parenting thing is obviously not nearly as difficult, right?
Mhm. Yeah. So, do you most often do co-parenting counseling during a divorce, like during the pendency of a divorce or after?
So I think that question really depends on the client themselves. So I would, my preference, right, or what I would recommend is that we're doing counseling as soon as possible,
Mm-hmm.
because a lot of damage is done. A
Mm-hmm.
lot of damage is done in the midst of a divorce,
Yeah.
because there's fighting happening. We don't agree. We don't trust the other person.
Mm-hmm.
We feel like we have to defend.
Mm-hmm.
And we do feel like we have to attack. I have to prove how bad this person is,
Right.
right?
Right.
And so we're really not our best selves for sure. And it's hard to really see clearly. We're really
Um,
looking through an emotional lens,
mm-hmm.
right?
Mm-hmm.
And the essence of trauma, when we really think about what trauma does, what it does is it puts us into that activation in our nervous system. And what I mean by that is it really sends us into, it's much more difficult to stay in our frontal lobe,
Mm-hmm.
where it's rational reasoning, right?
Mm-hmm.
And we really, and even it's difficult to hear.
Mm-hmm.
It's difficult to really listen and hear what someone is saying, to understand it, to say how you feel and articulate it, right? Our frontal lobes go offline, and our lower brain really takes over, which is our mammalian brain. And
Mm-hmm.
that's where all of our animal defenses are, which are our fight, flight, freeze, collapse, shutdown,
Mm-hmm.
right?
Mm-hmm.
And so if we're in that space and we're trying to go through a divorce and we're trying to co-parent, pretty difficult.
Yeah, absolutely. Um, and I think even if a couple can establish kind of the rules of engagement, just some ground rules that they're going to agree on in terms of talking points or um, what we're not going to say, which is often more important than what we're going to say to our children,
Mhm.
that can really, really help everyone move through that transition. So, but when people are triggered, they're not in their frontal lobe, they're high stressed. I talked to a mom today who just got served, and I could just tell like she was at the point where she wasn't remembering anything. Like she didn't know,
Right.
and this is not like unique to her. I remember I felt this way where it's like I don't know where to click to compose the message anymore. Like things that you don't
Right.
know. So how do you recommend people what are some coping tools for people who are in
Mhm.
that space who need to function and they can't?
Right. So I think the biggest thing that happens, right, is when we are dysregulated, when our frontal lobe is offline and we are just our nervous systems are stuck on, right? Whatever that might look like. The biggest thing to remember is that we regulate ourselves best when we're grounded in our bodies. Okay, so if you just sat with that for a second, when we're grounded, what does that mean when you're grounded in your body? Well, most of us are here, right? I mean, we're head up, we're in our brain, right? We're in we're in our thinking, right? But our lid is flipped and we're not rationally thinking, right? Then we're a little dissociated and we're
Mhm.
disconnected, foggy brained, like you just said. I can't even remember what button to push to compose the letter. So the most simple, and this is, and sometimes when I first talk to people about their breath, they're like, yeah, okay, thanks, that's helpful. But then we stop and we do it in session,
Mhm.
right? And I ask them, I said, just close your eyes for just a second and let's ground your body right here in the now. Can you feel your feet on the ground? Can
Mhm.
you feel your body in the chair,
Mhm.
right? Big, deep breaths. And I teach them breath work and they come back to their breath. And what happens as you take those big, deep breaths is your brain goes, oh, okay, we're all right. I'm calming down. It releases the chemicals and the hormones to slow our heart rate back down,
Mhm.
to lower our blood pressure, and to reground us back in our bodies, right? And so, just the simple tools of noticing your body,
Mhm.
pushing your feet down in the ground. I just had a woman the other day say, "Oh my gosh, I found myself getting so anxious." And she's a young woman. She's like 20 and she's a college student. And she said, "I just started lightly like kind of pressing my feet down in the ground and I started to breathe and I was like, okay, whew, wow, okay, I'm back in my body. I'm okay."
Mhm.
Right? So
Mhm.
being mindful and regrounding yourself with breath and with noticing your body.
Mhm.
And
Mhm.
I think that what happens, and you probably would agree, is what happens when people are in the middle of crisis and trauma and stress, self-care is out the window. We are in survival mode, right?
Yeah, I mean, everybody's got to go to a coping mechanism. And
Mhm.
some people drink too much, and some people gossip too much, and some people exercise too much. And as you're talking, I'm thinking about, the whole mind body connection and just how valuable like exercising might be. Like just moving your body, like the steps you take while you think have
Yep.
to be helping you process, right?
Yes, absolutely. And what you just said, no, I know people can't see what you're doing, but you did your hands like you're walking or stepping, or think about being on a bike, thinking
Mhm.
about, and something that I do and I utilize as a tool to help people process is EMDR, which is a bilateral stimulation. That bilateral stimulation, the reason that the research shows us that that helps activate our information processing system in our brains. And what that does is think about how you feel at the end of a walk.
Mhm.
Think about how you feel at the end of a run, right? Why do you feel better? Why do you feel better? Well, because your body is releasing that oxytocin, and it is releasing like feel good hormones, right, into the bloodstream. That's one of the reasons. But also what happens is, because of that bilateral stimulation, your brain's actually able to process, and you have landed in a completely different place. Your circumstances are different, but you kind of feel differently about it
Mhm.
because you've been able to process. And so, yes, engaging in exercise, but you mentioned something really important. You said some people exercise too much.
Mhm.
And so, something to think about is anytime we're doing something in a dissociative state,
Mhm.
okay, so dissociative, by that I'm meaning you're disconnected. Right.
Mhm.
Remember, like they couldn't see me kind of do this cut off, motion at your head, right? Where you're just up here and you're not down in your body. So if I'm running dissociatively, I've had clients who they didn't even realize they had stress fractures in their feet. They couldn't feel them.
Wow.
Yeah, they couldn't feel them. And they're like, oh, I could run for miles. I could run and run and run, doesn't bother me at all. They weren't feeling their bodies.
Wow.
They're just dissociatively checking out and running. Now, let's go for a mindful run. I can
Mm.
feel my feet hit the ground one
Mm.
at a time. I can feel my breath. I feel my body and the warmth of my body. It's warming up, right? I can feel the sun on my face. I can smell the grass and the trees and the blooms, right? I feel the breeze on my hair. And that is, I'm grounded in my body, I'm mindful, and I'm processing, right? And so in that point, it's really effective.
Interesting. Let's talk for a minute more about EMDR. I'm a huge fan of EMDR. I don't know that like it's necessarily something everybody in the general public knows about.
Mhm.
And when you first learn about it, the first thing you learn is that this is for PTSD victims and soldiers. So talk to me about what is EMDR?
So, okay, so I would just say that I consider myself an EMDR therapist. So I look at all my clients, I conceptualize through a lens of EMDR. I use other modalities too, like sensory motor and somatic and things that are involving in the body. But EMDR is for everyone. I think honestly that everyone could benefit from EMDR at some point. So, the basis of EMDR is in the AIP model, which is the adaptive information processing model. And that theory is the theory of the brain. How do I take in information and process it? Okay. So if I am everything that we're doing, everything, even now as we're talking, right? You're taking in this information, you're hearing it, and your brain is storing it. And then, maybe tomorrow or down the road, something's going to happen and you might go, oh, yeah, I remember when I was talking to Myra and blah, 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 blah. And all of a sudden, your brain is creating a chain of association and a linkage, right, to this other information that you're constantly pulling from experiences.
Mm-hmm.
Okay. Okay. So, what happens when there is a breakdown in our information processing system? right? What happens? So when the brain and the body become overwhelmed, right? When they become overwhelmed, I mentioned earlier, when our lid is flipped, our frontal lobe is offline. There's actually a little safety valve in our brain. And what happens is that if something happens, and it's like, I use an example of a car. Let's say a car is speeding towards me, and I don't want to have to think, that car is coming kind of fast. I should get out of the way, right? I just want to, right, and jump out of the way instinctually. And so that's the difference between us and animals, right? It's the difference between that frontal lobe and that upper brain and that mammalian brain. And so what happens is our frontal brain goes offline, and we go into fight, flight, freeze, our animal defenses.
Mhm.
When this happens, what our frontal lobe, because our frontal lobe is offline, we're actually missing the hormone that helps us to store memory in our long-term memory, where we can say, oh, this thing happened and now it's over. And what happens is that sometimes trauma that happens in our lives gets stuck. It gets
Mhm.
stuck, and it's not integrated into our brain the way that we need it to.
Mhm.
So this can be okay, what's trauma? Does someone have to die? Do I have to experience abuse? Like, what's trauma? Trauma is too much for too long, too little for too long. Trauma is big T, little t,
Hmm.
bullying, right? Um, Little experiences that I have had my entire childhood that told me I was just not good enough, no matter what I did, right? It could be a car accident. It could be developmental trauma, and developmental trauma is more about attachment wounding,
Mm.
more about how did my caregivers, what did I learn about me,
Mhm.
right? Through my relationship with my caregivers, right?
Mhm.
Did I learn that I can't trust people?
Mm.
Did I learn that, men aren't safe?
Mhm.
Did I learn that, whatever it might be? So, what happens when we experience a trauma and our brain and our body is overwhelmed and our frontal lobe is offline, that this experience becomes unintegrated and it gets stuck. And so I like to kind of give people a lot of analogies. So it's like you're walking around in a landmine and you never know when you're going to step on something, right? Where it triggers the chain of association and it triggers our trauma, right?
Well, I'll tell you, for most of our clients, they are walking around in the landmine of the next time I have to exchange my child and I have to see this person that I'm breaking up with. Like
Right.
most of my clients have a very similar, like, there's trauma associated with our relationship pattern that led us to get divorced. And if you're in a high conflict divorce, then it's almost like you're stuck in negative relationship patterns.
Absolutely.
And I
Uh,
think, like, for me, I used EMDR regarding that and just became a lot like desensitized to those, like, so I could get out of the negative relationship loops. And I see that also happen with parents and kids, where parents and kids can get in negative relationship loops, you know?
absolutely.
So I mean, that's not even like the trauma that you're talking about, which is like the real developmental, like, but this is like what most of my clients are dealing with. And so what can they do?
Yeah. So the reality is that what you're talking about is the triggers. And that's what happens is there's a trigger that pokes at the trauma.
Mm,
And then all of a sudden, we have all the symptoms, which are the thoughts and the emotions and the body sensations. So, somebody that's listening to maybe this podcast who's going through a divorce, right? They're like, yes, that's me. Every time I see my wife is calling and I see her name on my phone,
mhm.
right? Trigger.
Yeah.
And what does that trigger? I feel immediately I'm so angry, right? Or I'm anxious, right? Or every time I see my husband's email and it's like he sends me 10 a day, right? I get so upset, or I feel my heart races and I can't even think and my mouth goes dry, or whatever might be happening for them. Those are the symptoms that are happening because this trauma of betrayal or this wounding that has happened that they've really yet to heal from. is being poked at. And so
Mhm.
what we do is we go in and we look at what is it that it's being poked? What is at the core of that? What memories or experiences have I had, right, that are not processed because they are not integrated? And Billy, you just shared a little bit about your experience that you did some processing,
Mhm.
and it's not that all of a sudden, someone's ex is like, wonderful and doing all the things that you need them to do. What's happening is that you feel different.
Totally. Like you're just able to tolerate the situation without being quite as annoyed
Yeah.
or quite as your
Yeah.
body is no longer freaking out. You're like, I can handle this. It's pretty cool.
Yeah, this is not about me. That's actually what he just said or she just said is really not about me.
Yeah.
And so what I have control over what I have control over, and I'm just fine. Right. And to be able to feel that, because what happens is we reprocess and we use bilateral stimulation, we use eye movement, we can also use tactile. And what you do is you end up reprocessing so that this experience that I had, where maybe I felt like I was betrayed, or I can't trust, or I don't feel like I have control, or I feel like my voice isn't being heard, whatever it is that and because that's what we do is we look at the memory, then we also look at what is it that I'm believing about myself. That's not, it's a limiting belief. It's not
Mm.
necessarily truth.
Mhm.
It's how I feel about myself when this person does this, right?
Mhm.
And then we look at the emotions that come up and we look at where we feel them in the body. Everybody can think about a time when their chest got tight, right? Or
Mhm.
I felt like I had a lump in my throat, or
Mhm.
my stomach just dropped, or I have
Mhm.
tension in my shoulders, or I get a headache, or right? Those are all the ways that emotions and trauma get held in our bodies. And so
Mhm.
with EMDR, we reprocess it. I kind of call it like a digestive system for the brain. So you can think about like a big meal that you have that gets stuck in your gut. And you're like, oh, Thanksgiving dinner, I just ate too much. The body takes from it what it needs. It takes all the adaptive stuff from it and it just gets rid of the rest. And that's what we're doing for the brain. We're going to take what we need. What did I learn from this? What did I learn from this? What I learned is that I can, my voice does matter. It doesn't matter if they hear me or not. I know my voice matters and I'm going to say how I feel. Right. And I don't have to be angry about that. I
Mm.
can just say how I feel. Right. And so, what is it that I need to believe about myself? And how do I want to be able to feel when this happens again? Right. Well, I want to be able to see that phone. I want to be able to see my wife's name come up, or my ex-wife, or, potential ex-wife's name come up on my phone. And I want to be able to look at it and say, you know what? This is not a good time. And I'm not going to answer it right now. It can go to voicemail and I will listen to it and get back to her later. And
And
I
that,
can
that would be a powerful feeling for a lot of people. A lot of people feel, triggered by every contact and they can't turn it off and just come back to it later.
yeah.
So if people don't have access to EMDR, they should, but if they don't, is there, I've heard, and you tell me if this is, mumbo jumbo, I've heard you can do your own kind of bilateral, cross tapping or cross movement, or bilateral meaning, right left to get similar effects. Is that real?
Yeah. So yes, there is a lot of research in that bilateral movement. There is caution there.
Mm.
One of the things that I would say is often, not always, but often, our relational trauma that we've had with a spouse is not a new experience.
No.
And so what happens is there might be other relationships, or there might even be stuff that goes way back to childhood,
Mhm.
right? And what can happen when you begin to try to process on your own
Mhm.
is sometimes things come up,
Mhm.
right? That all of a sudden you realize like, wow, this is big and I'm really overwhelmed by this. And so sometimes it's not such a great idea to try that by yourself. Now, I would say in general, if we're talking about I'm just really working on regulating myself, and this is just a hard situation. My spouse had an affair, or they took all my money, or I don't know, whatever it is, right? Yes, going for a walk, tapping on your knees. We call it a butterfly hug, what you just did, where you cross your arms and you just rotate, just right, left, and you just use a bilateral. And yes, that can be very effective. And while I'm thinking about what you're saying, Getting Past Your Past was written by Francine Shapiro, and it's for the client, it's for the layperson. And she talks about EMDR, and she talks about learning how to do a calm, safe place, learning how to use your breath work, understanding what's happening for you, what it might be linked to. And she talks about bilateral stimulation.
Mm.
And so that is a wonderful resource for people if they're interested, if they don't have access to therapy or to a therapist, and they like to read. It's called Getting Past Your Past, and it's by Francine Shapiro.
Okay, so we are almost out of time. I have a couple more questions. Where is your center located?
We are located in Gilbert. It's 2680 South Val Vista Drive.
Okay.
And we're in building 15, suite 185, but you can always look us up too online, which is just www.integrativehealingcenteraz.com. And on that website would be links to all the providers so that you would have a way to contact a therapist, the esthetician, the nutritionist, the nurse practitioner, whatever it was that you were looking for.
Okay. And then the other thing is, can we get from you the 3 top resources that people should do if they're not seeing a counselor? You already said one, which was that book. And can you tell us the name of the book again?
Yeah. Getting Past Your Past. That's Francine Shapiro.
Okay.
Yeah, which is wonderful. And you know what? I'm going to really advise that there is some form of breath and movement. And, some people might be in a real depression and they might be really lacking motivation. So to get out and exercise, that just feels overwhelming. So, you know what? Get down on the ground and do some stretching. Just stretch and breathe.
Mm-hmm.
So connecting to your body in some form, right?
Mm-hmm.
Where you're working on regulating, you're working on your breath, and you're working on just connecting and listening to what your body is saying to you, I think is really important.
Mm-hmm. Okay, wonderful. Well, thank you so much for your time today. I really appreciate it.
Yeah, thank you for having me. I appreciate it.
Absolutely. We'll talk soon. Bye.
Okay, take care.